Hi students, welcome to the midterm exam review. And there has been updated, so I will include the newest version of the document for you. So I wanted to talk a little bit about academic integrity, just with what's been going on and us now taking the exams at home. I know that it's very tempting to cheat and to review your notes and the book while you're taking the exam. And I just wanted to remind you that that is cheating, and that does violate Cabrillo College's academic integrity policy, right? So using any sources that are not approved by the instructor during an exam is an example of cheating. So these exams are not open book, open study, or open note. And the reason for that is because our job is to prepare you for the medical assistant certification exam. And those are not open book or open note. So you must commit this information to memory in order to be able to pass either the national or a state exam. So if you don't do that now, you're not going to be able to pass the certification exam when you finish the AMAP program, and you won't be able to get a job as a medical assistant. And you will have spent, a year and a half studying hard and working hard and making sacrifices, and your family making sacrifices, essentially for nothing. So I really just want to encourage you to study. Study the book, study the exam guide that I'm giving you here, study your notes and the homework, and then when you go to take the exam, you will be well prepared and you won't have to feel like you need to look up an answer in a textbook. Okay? So, because of the fact that we can see, we pretty much know actually when people are doing that kind of thing. The Canvas exam logs all keystrokes and activity while you're taking the exam. So we can see how many times you change your answer, how many times you go back to it and adjust it, and we can see how long you spend on each question. So it's pretty obvious when you guys are looking up the answers, we can tell. And when you're using exactly the amount of time given for the exam to, use up all the time to double check your answers. So we've had to make some modifications to the way that the exam is going to be given. So as always, the midterm will be open for 24 hours. This exam is going to be worth 200 points. There are 113 questions. Majority of them are multiple choice, similar to what you've been taking and what you'll be used to. There's some true or false questions. There's some with multiple answers where you need to select all that are correct. And then now there's some essay style questions where you'll be able to just write in what you think is the best answer. And Linda and I will grade those accordingly. So time management is going to be really, really important when taking this exam. Okay, you'll have 110 minutes to take it, and you'll probably need most of that amount of time really to spend on the essay style questions. Okay. What the biggest change now is that Proctorio is not going to be set, because honestly, it's not really deterring anybody from looking up answers anyway. But now we're going to have one question shown at a time, and you'll answer that question, and then you move on to the next question. And once you've answered a question and moved on, you cannot go back and review it. Okay, so this is really big. So you will have to know the answer, basically. Hopefully you'll know it because you're going to be studying a lot, and then move on. And if you realize later that you answered it incorrectly, you can't go back and change it. Okay. If you absolutely don't know the answer to a question, then you use your skills, your test-taking skills, right, that Linda's gone over with you, and you use deduction to eliminate, the questions that you know are not correct. And then sometimes you just have to guess. It'll be a 50-50 chance, usually between two answers that sound plausible, right? So don't leave any questions unanswered, because then you have no chance of getting it correct. But if you guess, at least you have a 50-50 chance, 50% chance of getting it correct, okay? The points value for each question may be different, right? And the difficulty of the question is reflected in that. So don't spend much time on questions that are worth 1 point, okay? Kind of go through those, and then towards the end of the exam, it gets more difficult, and you're going to have the essay style questions at the end of the exam. So you want to make sure that you have time for those, because they're worth a lot more points, right? There's one question at the very end, I'll tell you, that requires that you watch a 3-minute video, okay? So you're gonna need to make sure that you allow time to watch the video and then give your thoughts on the video. It's completely subjective. So hopefully this helps prepare you for this style of exam. So really the main purpose is so that you're not spending a lot of time looking up the answers for each question, right? So you're going to have to spend the time studying instead, and hopefully learning the material. So let me just go over the material. So in Chapter 1, you're going to want to know what information is contained in a medical record and what the function of the record is. You need to know what HIPAA stands for and what its purpose is. You need to know what a chief complaint is and what it entails and how the correct way is to chart it. And you need to know what kind of question you would use to obtain the chief complaint. And you should know why a procedure should be charted immediately after being performed, or why not. Make sure you know how to properly make corrections to charting errors and how to sign off a charting entry. Make sure you know what the definition of a symptom is and what a subjective symptom is compared to an objective symptom. And make sure you understand why it's important to chart any instructions given to a patient, and when is a consent to treatment form required, and what does it mean when you as the MA witness a patient's signature on the consent form. And review what the advantages of an EMR are. For Chapter 2, understand what the growth requirements are for microorganisms, the definition of a reservoir host and a susceptible host, and what is OSHA and what is the purpose of OSHA. And make sure you understand what occupational exposure is, and then what an exposure incident is and what the difference is, and what types of individuals are at greater risk of occupational exposure, and what is the first thing you should do in the event of an exposure incident. Make sure you know what is PPE and when should it be used, and know the specific types of PPE. Make sure you understand what the CDC's recommendations are for hand washing and for PPE. And what is the purpose of the bloodborne pathogen standard. Make sure you understand the difference between engineering controls and work practice controls and have some examples of each so that you really grasp the concept there. And know examples of regulated medical waste and what that entails. And what is the most likely means of contracting hepatitis B in a healthcare setting. For Chapter 3, make sure you know what it means if an article is sterile and what the most common way to sterilize articles is in a medical office. Make sure you know what the common temperature and pressure settings for the autoclave are and when the timer should be set when using the autoclave, and what determines the proper amount of time for sterilizing an article in the autoclave, and what do sterilization indicators check for? What is the purpose of those? Review the sterilization wrapping materials, such as the wrap and pouches. Make sure you know what autoclave tape is, what it is it used for, what does it indicate, what does it not indicate, as compared to sterilization indicator strips and the difference between the two. Make sure you know why we wrap articles before they're sterilized in the autoclave, and understand when you would have to re-sterilize an article or a pack, and what you should do if there's any doubt about the sterility of an article. For Chapter 4, review the definitions of malaise, pyrexia, febrile, and afebrile. And make sure you know what a low-grade fever is and what a fever is. What are the temperature readings for those? Understand why you need to hold the arm close to the body when taking an axillary temperature. Make sure you know the difference between axillary and rectal temperatures and oral temperature. Make sure you know what color probe to use for oral temperature and rectal temperature readings. And review what age of a patient the rectal site should never be used for taking temperature. Review the tympanic membrane thermometer and what might occur if the lens of it is dirty, on the correct procedures for getting an accurate thermometer reading. Review how to measure pulse rate and what you should do if the patient's pulse is irregular. What does it mean when it's thready or bounding? Make sure you know where the radial and carotid pulse sites are, also brachial. What is the most common pulse site that's used? And what might occur if too light or too much pressure is applied when attempting to take the radial pulse? Review what pulse oximetry is and why we would perform that. And what does it measure? What is the abbreviation used to record the pulse oximetry reading? Review what blood pressure is. What does it measure? What's the difference between systolic pressure and diastolic pressure? And what conditions can have an effect on a patient's blood pressure, and how you should position their arm when taking the blood pressure. And review all the conditions that could increase body temperature, pulse, respiration, and blood pressure. And definitely know all of the normal adult ranges for temperature, pulse, respiration, blood pressure, and pulse oximetry, okay, for a normal, healthy adult. For Chapter 5, review what's included in a complete physical exam and why it might be required. How should you identify your patient? Review the definitions of acute illness and chronic illness and what the difference is. Make sure you understand what a risk factor is. And review the definitions for inspection, palpation, auscultation, percussion, and mensuration. And just review when we usually measure an adult patient's height and the child's height, and how should a patient's height be recorded. When do we measure adults and children's weight? What kind of visits would we measure those at? What items should the patient remove before being weighed? Make sure you know how many kilograms are in 1 pound. And review what you should do if a patient starts to fall when you're working with a patient. Review all of the patient positions and when you would use the different positions. And make sure you know what you should do to the chest piece of a stethoscope before applying it to a patient's skin. And review what your responsibilities as an MA would be during a physical exam. For Chapter 6, make sure you know the definition of visual acuity and the Snellen chart and what we use that for, and what distance do we conduct the Snellen eye test, right? And review how to conduct it, Make sure you know the definition of myopia, hyperopia, and presbyopia. Review what the Ishihara test is used for and how the book should be stored. And what is the most common color vision defect. Make sure you know how to inspect the ear of a child compared to an adult and how you would straighten the ear canal. Review the definition of irrigation and installation, right? And have some examples of why you would perform eye and ear irrigations and eye and ear installations. Review what the 3 main hearing acuity tests are and what's the most specific type of hearing test. Review tympanometry and what that would be useful for in diagnosing. And what does an audiometer measure? Make sure you know the difference between conductive and sensorineural hearing loss. For Chapter 7, make sure you know the recommended amount of time to apply heat or cold. And review which patients are more sensitive to heat or cold. Understand what the most frequent reason for applying a cast would be, and how long does it usually take for a fracture to heal. What signs may indicate that a cast might be too tight or that infection is developing underneath the cast? What are the symptoms that we would look for? Make sure you know the definition of ambulation and the main types of ambulatory aids. Make sure you know how axillary crutches are properly fitted. Okay. Review all of the crutch gaits. Okay. So there's 2-point, 3-point, 4-point, and the swing to and swing through. Okay. Make sure you know which is the most stable, which is the slowest, which is the fastest, what these would all be used for. You know, why there's differences and the benefits for each crutch gait. Review how a cane should be held and why that would be used, and also the use of a walker. Make sure you can define edema, erythema, maceration, a soak, a compress, exudate, and a sprain or a strain, and make sure you know the difference between those two. For Chapter 9, okay, this is what we talked about last week. Make sure you know what pediatrics is and what a pediatrician does, and when the first pediatric visit would typically be scheduled. Make sure you know the difference between a well child visit and a sick child visit, and why each patient would have one or the other. Review what is included in a well child visit, okay? And review what procedures you as a medical assistant will typically perform at pediatric visits. Make sure you know why it's important to measure a child's growth at each office visit, and review what topics are included in the anticipatory guidance. Make sure you know why it's important to measure head circumference. What are we screening for? What are we looking for? Make sure you know the difference between height and length, and when you would take a patient's height and take a patient's length. Review how the child's length is measured. Review what the purpose of a growth chart is and what does it measure and why do we do it. Review why it's important to weigh a child at each visit. Spend some time reviewing childhood obesity. Okay, there's a lot in the textbook about that, and what the guidelines are for helping to prevent it, and what we can advise patients on how to combat it. Review the definitions in the textbook for infant, toddler, and preschooler, okay, what the different age ranges are for each of those. And review the measurement of blood pressure in children and why it's important. And review childhood hypertension, okay, and what factors would cause that or affect that, okay. When is the recommended age of a healthy child to begin annual blood pressure measurement? Okay. What would happen if you use a cuff that's too large or too small? How does that affect the results of the blood pressure readings? Okay, it's the same for children as adults. Review why we would obtain a urine specimen from a child and why it's so important to cleanse the genitalia before applying the pediatric urine collector. What's the purpose of the collector? Review pediatric injections, okay, as far as intramuscular and subcutaneous and the difference and the different sites for each one and what needle length range you would use. So what would be the length of the needle to use for an intramuscular injection, right? What would that depend on? And what sites are recommended for administering intramuscular and subcutaneous injections? What site must never be used to administer an intramuscular injection to an infant or a young child? Review what the vaccine information statement is and who we must give it to and when we must give the VIS. Okay, so there's a lot of questions on Chapter 9 in the midterm, okay, because we haven't had the Chapter 9 exam yet. So I would say that's probably about 25% of the midterm is Chapter 9 pediatrics. So definitely spend some time reviewing that. Okay? Thank you, and we'll see you on Friday. Good luck, everybody.